Hi, welcome to Team Peterson. My name is Dr. Sean Peterson, and in this video I'm going to provide you with a little bit of a background about our team. I'm going to provide you some information about how our practice is changing in 2022, and also give you some information about our block fee program. So to begin, myself and our team of 14 staff endeavor to provide you with the best, highest quality, and most efficient care. Now, my practice is not large out of choice. We just do not have enough family doctors in the Sarnia area to provide care to all the patients. As such, I decided to grow my team so we can provide quick access, high quality, and efficient care to the patients that are rostered to us. When you come in to see us, you might see myself, you might see one of my nurse practitioners, but together we work as a team in providing that shared care so that we're all aware of the acute issues going on with all of our patients. I have 3 nurse practitioners working with me. I have Tracy Lampkin, I have Gabrielle Gogas, and I have Jerry Ding. As well, I also have a team of nurses and medical administrators who help support the whole practice. Our model is one that we reach out to you quite frequently, whether it be by email, whether it be by phone calls, or whether it be by our two-way messaging through what's called Corrigan. The last 2 years have been really challenging for all of us. It's been a very difficult time with COVID. Many of us have lost friends or family with the pandemic. But I really am hopeful that we're coming to the end of that pandemic and that we learn to live with COVID. What does that mean from a medical practice perspective? Well, it means that we have a bunch of medical issues that we need to get caught up on. We also have a bunch of medical procedures that also need to be attended to. From our practice perspective, we've learned in the middle of the pandemic that there are many things we can do much more efficiently than we were doing pre-pandemic. So as you've noticed, in the pandemic, we've reached out to you many more times and more frequently for quick telephone calls, for quick updates. And that's actually been quite efficient because it really does save you time from coming in and sitting in my waiting room for a half an hour to an hour, then being seen, taking time off work. That model that doesn't make sense. That said, we're happy to see you in the office and examine you as we move forward and out of the pandemic mode. As part of this change, we're going to be introducing more virtual presence. This means that we'll be reaching out to you by telephone, by two-way video conferencing, by conferencing in your loved one, but I also want to introduce more education. And my plan is to be recording at least monthly, but hopefully eventually weekly webinars where you can come join me online to talk about a given topic. This might be a topic around diabetes, might be a topic around high blood pressure. But I want to be able to touch base with you on a more regular basis, and that's the plan for 2022. I might take a quick moment just to remind you of the different ways you can get a hold of us. We do have a call queue system, so if you call in, we'll answer the calls in the order they come in. Our number has not changed. It's 519-337-7512. A quicker way to get a hold of us, though, for booking appointments is either through text message or email. Our text message number is 519-328-0563, and our email address is info@drpeterson.ca. Additionally, we do offer secure two-way communication via Corrigan, which is our messaging software. During the pandemic, we did use email to help facilitate some quicker conversations, but due to privacy laws, moving forward, we're going to be moving all communications that involve medical information over to Corrigan. There's a link on our website to be able to sign up for a Corrigan account so you can receive and also send two-way communications with our office that is secure. Now, we have changed the way that we book appointments. When you call in and ask for an appointment, our medical admin staff may book you in the office if it's something that they know needs to be in office, and they'll simply get you a book date and time. But for many conditions, if you call in with a concern, what we're trying to do now is we're trying to do same-day triage, where a nurse will call you back, discuss the issues, then review with either myself or one of the nurse practitioners, and the nurse will call you back, or one of us will call you back, ideally within 24 hours. And the idea here is we want to get a jump on sort of figuring out what the problem is start to get some investigations going, get some treatment going. So by the time we do see you in the office, we're already that one step ahead. So please be patient as we get this model in place. Obviously, the busier days for us are the beginning of the week, so Monday is the busiest day. So if you do call in Monday, we'll get back to you there within 24 hours, so by Monday or Tuesday. Now, if we don't have the capacity to see you for an urgent issue, our staff may refer you to the Rapids Family Health Team Access to Care Center, which is located on the first floor in our building. Our staff will guide you through that process. A third option to be seen, every Monday through Friday from 5 p.m. till 8 p.m., our family health organization runs an after-hours clinic, which again is located in our building on the first floor in the Rapids Family Health Team area. The way to access this service is to call them in advance at 519-491-6188. They will do a telephone triage, and similar to our office, will either call you back to speak to the doctor or they'll invite you in to be seen by the physician here at our building. I wanted to spend a quick minute talking about our pharmacy walk-in clinics. I don't encourage you to go to these clinics. These clinics are typically virtual clinics with a doctor out of Toronto, and I do not believe that the quality of care is sufficient at these clinics to do them justice. Furthermore, by attending the after-hours clinic, the physicians there are part of my team, they're part of our family health organization, and they do send information to me. Whereas the walk-in clinic, I tend not to get that information. So I really encourage you not to use the pharmacy-based walk-in clinics, but rather to use our own family health organization after-hours clinic here in our building. During the pandemic, I put a pause on charging for many of the uninsured services that OHIP doesn't cover. But as of April the 1st, 2022, I do unfortunately have to put these charges back in place. These items are not covered by OHIP, and they are quite time and labor intensive for my staff and myself. Some of the examples of these items would include the prescription renewal requests, either by telephone, by email, by fax, or from your pharmacy's request to us. We're going to be charging for each one of these going forward, and the charge will be $30 per request. Other items that are currently not covered by OHIP, but we are going to be charging for, also include travel visits. So coming to see us to talk about going away on a trip, I'm excited to have that conversation, but that visit is going to be a $50 visit going forward because OHIP doesn't cover it. Now, another common item that's not covered by OHIP would be the work and school, either sick notes or return to duty notes, and those currently cost $25 each. There are some other items that you can find on our website that are not covered by OHIP, and our price list is found on the website. An alternative to the pay-as-you-go model of care for these uninsured services is to consider subscribing to our block fee program. In the past, we've run this as an annual fee where everyone was sent a letter in January, a fee was paid for the year, and that covered everyone for the whole year. Going forward, I'm moving to a web-based system to subscribe. That way there's no checks to write, there's no email and mail to send back and forth. Rather, you can simply subscribe on our website by clicking in the top left corner the Join the Block fee. This fee, which ranges from $8 to $15 per month, will cover you for many of the uninsured services or provide a considerable discount. Many of our patients find the highest value in having their prescriptions renewed at no cost, and also having the discount on drivers, medicals, and other insurance forms. I have another video that's going to come up down below that further describes the block fee program. To conclude, I'm really excited for 2022. I'm really excited to be moving into the virtual world of connecting with you on a more regular basis. I really encourage you to come back and check our website. We're going to be adding content and videos on a regular basis. We're planning to have a YouTube channel which provides much of the similar content, and I'm really excited about the small group sessions. So keep an eye out for those. It'll be coming soon. I very much appreciate all of your time watching this video, and I wish you all a good day. Thanks.